Too few people have the privilege of knowing someone who truly believes in one of these values, let alone someone who lives by all three. I believe that William Mayo, one of the 7 founders of the Mayo Clinic, was referring to Dr. Busby's qualities when he said, given one well-trained physician of the highest type, he will do better work for 1,000 people than 10 specialists. Tonight, we can all boast of knowing at least 2 of these people. I'm honored to be introducing one of our St. Luke's inductees, Dr. James Johns. Knowing him professionally as well as personally, as many of you do, it seems only natural he has made it to this podium. A few months ago, when we found out he was being inducted, my mother smuggled me Dr. Johns' application for residency. And as I waded through the paper, written more than 30 years ago now, I realized that Dr. Johns had succeeded in living up to his self-proclaimed dedication to community service, and he had grown into the empathetic, devoted, and understanding doctor he claimed he would be. He wrote that family practice was not just a role to be filled, but a lifestyle carried on by someone who brings with him his own set of values. A lifestyle, he said. And his life is caring for his patients, just as he cares for his family and friends. Dr. Johns' values took root when he was a child. He credits his parents' close-knit cultural loyalties and the community ties that were part of the same package, which was most likely a factor in deciding to open his practice in his old neighborhood. He grew up with a respect for life and passion for community that never faded. And to this day, he serves our area through the Board of Community Services. He has sacrificed his time and offered his knowledge to the McKinley Sports Program for decades as their team doctor. He runs 2 hospitals, multiple nursing homes, and still makes house calls for our patients too ill to make the trek to the office. His day starts and ends with his patients. And he understands that the people he treats don't care how much he knows until they know how much he cares. And after meeting him, they know they're in the hands of one of the few doctors who sees past the power and past the money, obviously, or he wouldn't have gone into family practice. They know they're in the hands of a man who still believes in the sanctity of the Hippocratic Oath, the hands of a man who still tends to the soul of medicine. Ladies and gentlemen, Dr. James Johns.
The Board of Directors, Sister Judith and the Sisters of Charity. I want to thank the induction or the selection committee for this honor and this recognition. Pretty cool to be inducted with Dr. Beth Prosser, a fellow beacon in primary care. We're all part of a team that depends on one another's knowledge and ability to run a high-quality system of healthcare, including wellness and disease management. What I'm able to do professionally as a physician, I cannot do without my team. I value my colleagues in primary care and in specialty medicine. I depend highly on nursing as patient advocates and as the bridge between what people need and what we have to give. My team includes all the ancillary departments involved in patient care. A number of members from my office team are here tonight. Kathy Rambod has been with me the longest. She's lived through many of the changes that we've had at my practice, has been my nurse and my office manager. She knows that sometimes when I get my mind set on something, I could be like a dog with a bone. Thanks for knowing how to handle me. I'm also blessed with Heather Gore, my nurse, and Sandy Collier, my family nurse practitioner. They're like family to me. As far as I'm concerned, in most of our patients, there's no better office nursing family. I want to thank Father Tom Bishop for being here. We've been blessed to have him as our priest at St. Anthony's for most of my adult life. He's freshly retired, and I wish him all the best in his future. Some of my friends and family who have supported me and nurtured me through the years are here tonight. My Uncle Ernie Scazzarella, my cousins Deb and Doc Mosier, Angela Smith, Irene Lewis Motz, George and Therese Gilbert, my great friends Mark and B.G. Skaken, Jim and Kathy Harris, and my best friend since 5th grade, Jim Batchelder and his wife Jackie. Jim and I did so much together in our youth, I actually got to go out on their first date with them. It was fun. I thank you all from the bottom of my heart. God blessed me with the greatest family around. I know how proud my mom and dad are of me going into St. Luke's. They inspire me by the examples they set of love, friendship, and family. And they fueled me throughout life with really good Italian and Syrian food. I know they're proud of me, not because of this induction, but because they loved me unconditionally and would have been proud of me no matter what I did. My father-in-law, Corky Corelli, is the pillar of the family and such a great example of how good life is when you're willing to work hard. There's a right way to do things, and as long as I understand that the right way is his way, we get along great. I have the greatest children, and I'm blessed to be their stepfather. They're the family I've always dreamed of. Jared is a hardworking, caring, smart, handsome electronic genius, and a fantastic chef. If you eat something delicious at the Irish, there's a good chance he created it. Laura, who you already met, is beautiful, caring, family-centered, a great friend, daughter, and mother. She's an expert historian and writer, and she knows how to push the envelope. Jace, my grandson, is 11. He's really cool and smart as a whip. He is full of life. I'm so proud to be his papa. He is our future, and the time I spend with him is precious. I fell in love with Donna before I ever met her. She's my example and inspiration of living each day fully and loving unconditionally. She's my best friend and my partner. She's the driving energy behind what we do at Little Flower Family Practice to keep the patient at the center of everything and give the highest quality care. She's the force behind the good systems we have in place to provide the triple aim of quality, efficiency, and satisfaction, and to use the good about electronics to be a patient-centered medical home. Anyone who has ever worked with Donna knows how fortunate I am that she runs the practice. Anyone who knows Donna knows that I'm the luckiest guy in the world to be her husband. I love her more every day, not because of what she does, which is great in itself, but because she's my Donna and I was born to love her.
Okay.
Sometimes there are forces at work that line up and make things happen that are supposed to happen. When I was looking to open my family practice in 1985, there was no space available at the old Little Flower Hospital building. About a month before I finished my residency in family medicine, one of the docs practicing there, Dr. Levy, had an unfortunate accident, broke his hip, and decided to retire. Office space opened up, and I started my professional journey. For the record, I had nothing to do with Dr. Levy's accident. My office was also the office of Dr. Andy Abel, my mentor and my friend, and one time was the home of Dr. Harry Schufel, both of whom are in the St. Luke Society. One of my first days back in the 1980s, I learned that sometimes patients are motivated by things that are not necessarily the best for their health. This motivation is especially intense if you're a fresh new doctor out of training. I remember seeing a new patient who stated that he had severe narcolepsy and needed Ritalin right away. He was pacing and agitated and couldn't sit still, kind of the opposite of what you expect with narcolepsy. And if I didn't write the prescription right then and there, he would just fall asleep and die. Another new patient stated he just moved from Florida to town and came in complaining of severe terminal pain and needed morphine. Unfortunately, he didn't remember that I had cared for him when I was a resident in Akron City a few months earlier. When I reminded him of this past relationship and that I knew he wasn't terminal, he was promptly cured and left the office. Now, luckily, these are the rare exceptions. I do have the perfect patient panel in my practice. Family medicine allows me to care for any age. My youngest patient is now 1 week old. My oldest so far has made it to 106, although I have about 10 trying to beat the record right now. I've been fortunate to be McKinley High School's team physician since I started practice. In family practice, you have the opportunity for fellowship training in sports medicine. Because of my experience as a team doc, I sat for the exam and became certified. I've had the privilege to work with student athletes who would go on to become college stars and coaches and professional stars and coaches. Now, I know that's really cool, but what's really especially rewarding is working with all the student athletes that matured into life as trainers, accountants, white and blue collar workers, teachers, and a variety of other vocations and professions. In many cases, I've gotten to work with their children as they came through the same system. Jim Harris is my brother in sports medicine. The athletes in Stark County have benefited from his years of passion and dedication involving sports medicine through the schools. He's helped thousands of students to grow in life through their participation in sports. Jim gets me involved in most of his ventures. I'm one of the Canton Charge team docs, and a few years ago, I was fortunate to cover the Junior World Football Championship here in Stark County. Somewhere along the way, Jim volunteered me to be the U.S. representative physician to the World Anti-Doping Agency, or WADA. I found myself getting emails from Finland, Sweden, New Zealand, and all over the world to issue therapeutic use exemptions for high school students to allow them to compete on appropriate medications. It's been about a year since my last email. I think Jim volunteered someone else. Sports medicine and athletic involvement affects any age and any patient. It's been fun to involve and counsel all my patients on ways that athletics can help keep them younger and healthier. I recently encouraged an 80-year-old to get his 21-speed mountain bike out of storage and start riding again. He was doing great until he got a new pair of riding shorts that were looser than he was used to. He was dismounting, they caught on the seat, and down he went with the bike. Now I'm advising the same patient on athletics after hip replacement. It's called a practice because you're always trying for perfection and never quite able to reach it. At Little Flower Family Practice, we've tried everything over the years. We went from the highly advanced pegboard billing system to word processing, and then to an evolution of computerized billing systems. Under Donna's guidance, we were one of the first practices in the area to take advantage of the provisions in the Affordable Care Act to help small practices fund implementing electronic health records. Now, I remember significant days in my life. I know the day Kennedy was shot. I know the day we landed on the moon, the resignation of President Nixon, and the fall of the Soviet Union. On July 27, 2011, I went electronic. Now I live in the electronic health record universe. Then, in 2012, I was summoned to the White House as an electronic vanguard to present to Health and Human Services on how to run a practice on electronic medical records. My office employees were laughing so hard they ruptured themselves at the thought of me advising anyone on the proper use of EMR. We were all impressed that Health and Human Services wanted to know how it was in the trenches, and they contact me, meaning Donna, still to work out issues. I run an outpatient family practice, and I also do inpatient medicine. Some think that makes me a dinosaur. Let me say a few words about that. We value patient and family satisfaction as a major component of quality care. Nothing satisfies a patient more than to know that the physician that knows them the best will be caring for them at their most vulnerable times, when they're in the hospital. I realize that primary care rounding on their own patients has left the mainstream. In our certification application for patient-centered medical home, we have to show examples how our outpatient physician, me, communicates with the hospital physician, also me. When we submitted this, and that I'm the same doc that rounds and that does outpatient medicine, a bank of computers short-circuited. TransferMed's response was, well, just submit a screenshot of you communicating with yourself. I talk to myself all the time, I just need to get pictures. I was selected by Dr. Sabe to be Mercy's first heart failure medical director, as we were certified as a patient heart failure center. This was an honor. He understands the importance of primary care and chronic disease management, and our center is a great example of how specialists and primary care work well together to provide the best care possible. The patients are the center at Little Flower Family Practice. Practices like Donna's and mine and Beth's and Terry's are the answer to the high cost of medicine and the quality failures that occur. We're now being recognized by NCQA, but we've always been the best healthcare delivery model around. One of the purposes of electronic health records was to reduce medical errors. Are you kidding me? There's now a brotherhood of providers who've experienced electronic documentation. It's like having served together in a war. It's hard for those on the outside to understand. While the initial intent was good, and those that are developing the systems are working to their fullest, not all the systems are going to have their intended effect. It's up to all of us to protect the patients while we are upending the paradigm. A lot is good about EMR. Granted, sometimes it's really hard to see. We need to find what is good and nurture it, and what is not good and change it. We can't get so caught up in documenting that we lose sight of good patient care. The Society of St. Luke was established to recognize and honor service to patients, the community we serve, and to support the mission of the hospital, to provide quality, compassionate, accessible, and affordable care to the whole patient. Well-designed and well-run EMR can be a way to better achieve these mission goals by allowing better population management for the community and chronic disease management for those who need it. We just need to watch what we are doing. With the ropes of the past, we ring the bells of the future. We've done a lot of really good things in medicine up to this point. It doesn't mean we shouldn't evolve for the better and adopt new systems and methods that are needed. We're all doing that and should be. But don't just march forward and change blindly because someone said so. Be aware of the effects you're bringing about while holding strong on the good of the past. Practicing good family medicine requires continually adopting new knowledge, skills, and techniques while staying rooted in the compassionate care for the whole person and their family. I am a progressive, cautiously electronic, evidence-based family physician, and I'm glad, but I'm also a dinosaur, and I'm proud. Thank you all so much.